Alright, so thanks for joining us here again. I'm going to be going over some special tests for patients who have suspected concussion or head injury. These are used to assess their coordination and balance directly after the injury. So if they are grossly uncoordinated, or there are going to be some certain things that we're looking for that would indicate they have some loss in balance. So the first one I'm going to do is the Romberg test. You can have the patient standing with their feet shoulder width apart, and then their hands will go on their iliac crest or on their hips. And you'll ask them to close their eyes, and if they can just hold that position without falling or taking a step out or stumbling, or without any like swaying left and right or forward and back. And then there are some modifications you can do to the Romberg test to make it more difficult. So you can ask the patient to stand up on their non-dominant leg and have their knee flexed at about 45 and then hip flexion at about 90. So right about there. And they can hold this position. If they can do that just fine, you could ask them to tilt their head backwards. That would make it a little more difficult. As you can see, she does fall out right there, which is fine. It's a tough balance test. And the most difficult progression for this test is to ask the patient to put their arms out to 90 and then ask them to do successive taps with their finger to their nose as fast and accurately as they can. Which she does pretty well on that. Alright, so that would be the Romberg test. What I am looking for positives during this test would be, as you saw a couple times, if she falls out. It's normal for people to have not perfect balance, so that may happen. It's nice to have a baseline test to compare it to, so if you've done it before or if you know the patient's history with their balance, you can better judge what coordination they've lost based on the injury. So the next test I'm going to perform is the tandem gait test, and for this you'll have the patient stand in front of you. And I'm going to be assessing, she's going to be walking in a straight line, it's going to be heel to toe, and then some errors that I'm going to be looking for is if when she takes a step, if her heel does not contact her big toe, if she does not walk in a straight line, so if she starts to veer to the left or the right, and then when she's taking her steps, if she has to contact the ground when she's coming around, that would be a positive as well. So I'll move back a little bit. I'll just have the patient do about 4 or 5 steps. And then you can ask the patient to turn around and do the same thing going backwards, watching from behind, seeing if everything stays in the straight line, that she's contacting that heel to toe. Alright, she was able to do this test with no problem. The final test that I'm going to be performing is the modified air balance scoring test. So this is a series of positions that you'll put the patient in and ask them to hold for 20 seconds. And then there are going to be certain things that we are going to look for that would be indicated as a positive, and you'll want to count each air that occurs. This is used in the SCAT-5 testing. So the airs that we are looking for, there's quite a few. So the first one is they're going to be having their hands placed on their iliac crest. So if their hands at any point come off of their hips, that is counted as 1 point. The second thing would be is if their hip goes into more than 30 degrees of abduction. So if while they're standing they start to lean over significantly. The second would be is if they have a stumble or fall out of the test position. If they stay out of that test position for more than 5 seconds is another air. And then also if their heel or toes come off the ground during the test, that is another positive. So now that I've explained some of the things that we're looking for, I'll have the patient stand right there, feet shoulder width apart. And the first one is that Romberg's test. So she would be standing there with her hips, or hands on her hips, and eyes closed. And then I would be counting this for 20 seconds, seeing if she has any of those things that I talked about. Another error that I didn't mention is if they open their eyes. So if they have to open their eyes at any point during the test, that is another point that we mark. So this one, pretty simple. The next thing that you would do is the single leg balance test. So that's another modification to the Romberg test that's included in this special test. You'll have them stand on their non-dominant leg, and if you can get your hip up a little bit more, there you go. And then you would ask them to hold this, so we are looking for those airs that I mentioned. If she opens her eyes, if she has a stumble or fall and her foot contacts the ground, if she stays out of that test position for more than 30 seconds, if her hip starts to go more than 30 degrees of abduction, so she starts to tilt, and then if her forefoot or heel comes off the ground as well. So there's a lot of things that I'm looking for, and that would be about 20 seconds for this one. The final modification is to do a tandem stance. So you put your non-dominant leg forward, and you'd go heel to toe, and then they would close their eyes, and they're going to hold this position for another 20 seconds. So with this one, you'll want to see if either of their feet or heel comes off the ground, and as she had to take a step out, that would be something that would mark as a 1 point. And then also just any swaying that may happen. So those are the three positions that we would put the patient in for the modified air balance scoring test. So now that I've gone over 3 special tests for suspected head injuries, you can better diagnose or test for concussion based on their loss of balance or coordination. That is the end of the video.